Well, I want to take a minute to introduce the team of people that represent the immunization outreach group at Spokane Regional Health District, and they're in the back if they would stand up, Danette Dronenberg and Patty Peter. And one of the reasons I want to make sure that I introduce them is because some of you have worked with them and not been able to put a face with a name until now. We're a fairly new team, but we're doing great work at the health district. And as we go along tonight, we talk about some of the strategies that you can use. This will be the group of people that will help you with improving your immunization rates, or maybe starting out with understanding your immunization rates in your clinic. So there's three things we're going to talk about really quickly. We're going to talk about the reminder recall system. Dr. Carey touched on that. We're going to talk a little bit about office policy and a little bit about EMR systems. Just as a review, one of the biggest things I want to make a comment about for you is that completing the series is important. And many parents feel that, like when I get phone calls, I have parents that started a series but they didn't complete it, and they're relieved to know that the recommendations are that we just pick up where we left off, so we don't have to restart the series. And that's an important piece for parents to understand when they're calling, or for young women or men when they call in, that interrupted series are okay for completion. The next thing we want to talk about is that reminder recall system. The reminder systems are the ones that track future appointments. The recall systems are the ones that track missed appointments. So just to kind of give you a little bit of an understanding about what those are. The reminder recall system in the IIS, the system formerly known as Child Profile, we can actually run those reports for you, or we can teach you how to run those reports in your own office so that you can see who's behind on those appointments and get those kiddos in for their shots. What we find though is that doing both of those systems together, the combined tool of reminder and recall, is what is going to be the most effective with increasing your vaccination rates. What we know about kids that are behind on their immunizations is that they're also at greater risk for being behind on other preventative services. And our studies suggest that fewer than 1 in 5 pediatric or multi-specialty group practices are using any kind of reminder recall system. So one of the things that we call an immunization information gap is in huge prevalence in our community, and that's where moms think that their kids are well vaccinated and providers think that their kids are well vaccinated. So one of the reasons we talk about using the immunization team that we have at Spokane Regional Health District is because we can help you with reality orientation. So we can help you with figuring out exactly how well immunized your kiddos are and maybe start to bridge that gap. One of the other things that we talk about is being organized in your offices. And sometimes this is hard to do. You have a lot of patients, they come and go, and you don't really know where to start. So we can help you with putting together some tools, and I'll make some suggestions this evening really quickly about different things that you can do. Some of the tools that we'll talk about are pretty low tech, and sometimes low tech is the best. And for larger practices, it's just not feasible. So kind of just sift through some of the suggestions that I give you and make some decisions based on what might work for you. So what we know is that we have the American Academy of Pediatrics that endorses that reminder recall system through their policy statements and their reports. So this isn't just something that we're making up. Providers don't have to invest a lot of time or money to develop and implement and have ongoing reminder recall systems. But by evaluating your resources and your needs, providers can implement simple, effective systems that are suited to their practice. And then I've included a web link that has some more information for you. One of our options is chart reminders. And that's something as simple as a colorful sticker that you put on the front of every chart. That sometimes they can be a comprehensive list of all sorts of screenings that are needed. And what we know about those checklists is that they're most effective if they require either an initial or a date. And they can stay on the front of a chart. That only works, of course, if you're still using paper charts. If you're using electronic charts and you do have something that is printed out, something that travels with the patient from the different points in the clinic, is that there are tools that can be printed out either through an EHR or through the IIS that will help with creating tickler systems and reminder systems that educate and improve vaccine uptake. The advantages are that it's an inexpensive system, it's efficient, and on average, providers that use the reminder recall systems that are the chart reminders, it takes them about 4 minutes, and it quickly becomes part of a provider's routine if that is what is implemented in your office. The disadvantages are it only reaches the patients that are actually in your office. It doesn't reach the ones that need to come. And the chart reminders really are probably most effective in a managed care system as opposed to a fee-for-service system, because what we know is one of the barriers is having to pay for office visits each time you come in. Then we have the mail and telephone reminders, and we know who's going to do this work. It's not going to be the providers, it's going to be the office staff. And all the office staff think that they have too much to do, and what we really need to do is create an environment where completion of immunization series is a priority. So for the mail and telephone reminders, that's where the staff phone the patient, or they can send a postcard or a letter reminding the patient that a vaccine is due. If they're calling, there's some advantages to that, which is that they can schedule right away. If a parent has a question, oh, when was that due? Oh, what is she due for? Or what is he due for? Those questions can be answered immediately. Whereas with a phone call or with a postcard or letter, there may be some confusion about what is expected or what is the next course of action. Another barrier to sending a letter is if you have a patient, if you have a bilingual office, making sure that you're sending out the right tool in the right language so that they know what to do with the information that you've sent them. Another disadvantage is there's two things that happen. One of them is if you have a transient population where either they are moving in and out of your clinic or moving, just moving, is that you may not have a current address. And those are super effective and necessary when we are calling or sending letters. The second thing is if you happen to be one of those clinics that has a very high immunization rate, then doing this reminder recall system with the mail or telephone calls doesn't really up your rates. So starting with knowing where you're at is a great baseline for you. Another thing that we need to talk about is expanding clinic hours. Lots of people think about this. Flu season is a huge time to think about having Saturday morning clinics or having evening clinics. What we know is that they're convenient, and our low-income families where they're reliant upon those work hours to earn their money, they don't have sick leave time that they can take to bring Johnny or Susie in for a shot. If we have expanded hours, they're more likely to come. It's also quicker. They know if they're coming just to an immunization clinic, they can get in and out rather quickly. We find that we're giving more vaccinations in those clinics, and part of that is that we're reducing the administrative barriers with the paperwork and the waiting time and provider visits. And the disadvantage to that is that we have to reallocate our staff time. So you may have to do some flex schedules, pay some overtime, however that works. And then if you have clients that come and they haven't previously been seen in the clinic, you may have issues with accessing immunization records after hours if you're calling from state to state, or if their immunization records are not in the registry, you may not have access to those records if they're not with mom or dad when they come in. And this brings us to our computerized immunization reminders. And this is where the IIS, Washington IIS, formerly known as Child Profile, comes in handy. There's also a lot of EHRs that do this as well. They have the capability of creating tickler systems or forecasting systems. And so what we see are reports that can be run the night before on the patients that are scheduled, which can help prepare providers as well as the support staff for some of the things that will need to be done during the clinic that day. Oh, Johnny or Susie are here, just to make sure you remember that they're going to be getting their second HPV today. Those kinds of things. once the software is paid for, once the EHR is paid for, those programs can be really inexpensive to run those kinds of reports. Now, sometimes it's just as simple as knowing who to ask in IT to see if those reports can be run. In the IIS, it's free, so you can call us at the health department and we'll help you with learning how to run those reports, or come out and teach you, which is a lot more effective to actually come to your office and teach you how to run reports. And that will increase the access to the immunizations. So the most effective thing we know is to use multiple systems. Don't just do one thing. Don't just have patients, when they come in for their first HPV, write their address on a postcard and put that in a tickler system that you're going to mail out when they're due for their next shot, or keep those in a tickler file, having already scheduled those 2 follow-up appointments and only mailing them if they miss the appointment. Just doing that alone will help, but it's not as effective as using multiple systems. Standing orders are really important. Standing orders are great because any child that meets the criteria of the standing order then can get an immunization without waiting for a provider evaluation. And we use this a lot, like with maybe second and third, more series completion rather than initiation of vaccine series. And this provides us, loops back to that strategy that we talked about with the extended hours or vaccine-only clinics. And some offices do vaccine-only times within a day or several times throughout the week where patients are scheduled just to come in for shots. So they don't have to go through the whole fitting into a provider's schedule and their availability in order to get their next immunization. So one of the tools that we have available to us in the IIS is the ability to forecast as well as determine the vaccination rates. And we've talked about that a little bit, that if you're interested, we can show you how to run a report and you can find out your current immunization rate. It's a great basis for starting a reminder recall system. If you're looking at maybe, gosh, should we start a system where we have vaccine-only clinic times or an extended hours clinic, it's a great baseline because it gives us something to measure later on after an intervention is put into place. We have 2 ways of getting information into the IIS. The easiest is the use of an HL7 interface, which is where your EHR bridges information and talks to the IIS, which dumps information in there. So when you go into the IIS, you can see Johnny or Susie have had their shots. That's the most efficient way of pulling information out of the IIS, is if it automatically winds up there. The alternative is to enter the information into the IIS directly, and that takes about 3 minutes per shot if it were to be put in, if that was just one. If you're doing multiple, it doesn't take quite that long. And that's an option for several offices and for several clinics. And what I had intended to do this evening is spend some time showing you the reminder recall system that we have in the IIS, but I'm not going to take the time to do that because we're running a little bit short on time tonight. But just take my word for it. We have a really quick system in the IIS where you can run a report that is specific to patients that are due for a 2nd or 3rd dose of HPV and they are 1 month behind or 3 months behind. And the system will give you a report and actually give you the opportunity to print labels, print letters. It's all in there. So we can show you how to do that and make that system be a lot more kind of in the bag for your clinic. And the IIS has obviously developed that because we would like to improve our immunization rates.